Guided surgery provides numerous benefits, including the ability to place implants in more ideal positions based on a restoratively driven treatment plan. It allows a flapless procedure if indicated to be performed in a more precise manner. And implant placement can be performed with a higher degree of safety as vital structures have been pre-identified pre-surgically. However, the surgeon must be aware that guided drills are longer than standard drills, since they're going to go through the surgical guide, potentially through the soft tissue and into the bone. This can be an issue if the patient has limited vertical opening, particularly for posterior implants. The total drill length for materialized surgery guides, which are cases planned on the Implant software, varies and is based on the addition of three numbers: the length of the planned implant, the height of the guidance sleeve, and the prolongation length. The prolongation length is a distance from the top of the implant to the bottom of the sleeve. If a mucosa level surgery guide is ordered, the prolongation length will be slightly greater than the thickness of the soft tissue. A bone level surgery guide would obviously have a shorter prolongation length than a mucosa level surgery guide. The prolongation length may also be affected if the sleeve would collide with an adjacent crown. A drill guideline is supplied with the surgery guide, listing the total drill length for each osteotomy. In other guided systems, such as Noble Guide, they have a fixed distance from the top of the implant to the top of the sleeve in the surgical template. In Noble Guide's instance, the distance is 9 millimeters. The drill guides that fit into the sleeve have a 1 millimeter flange. Therefore, the total depth is the length of the implant plus 10 millimeters. The parallel-walled Noble Guide twist drills are 10 millimeters longer than their standard twist drills. The overall length of the Noble Guide taper drills is approximately 6 millimeters more than the standard taper drills. If you are considering guided surgery, the vertical opening can easily be assessed at the consultation appointment. A quick visualization can be made by placing a guided drill in the handpiece, asking the patient to open wide and see if you can fit the drill over the intended implant site. Here you can see we're trying in a 2 millimeter diameter guided twist drill from Nobel as compared to the standard 2 millimeter twist drill. Next, we tried in the guided 10 millimeter taper drills and 13 millimeter taper drills just to see what would fit. There are various ways of dealing with the limited vertical opening during the procedure. First, to the obvious. If a patient has a removable prosthesis in the opposing arch, it should be removed after the anchor pins and/or horizontal fixation screws have been placed. If the drill is too long, you may want to start with a shorter drill, then place the longer drill through the surgical guide into the osteotomy, attach the handpiece, and then continue on to the desired depth. A key to success with guided surgery is becoming familiar with the components and understanding their uses and limitations. Evaluating the patient's vertical opening up front can eliminate surprises and help the case go smoothly.